The prostate is a gland of the male genital system, formed by fibrous and muscular tissue, and is located in the lower part of the abdomen, immediately below the bladder and in front of the rectum. Weighing about 20 grams and shaped like a walnut or chestnut, the prostate can swell and increase in volume over the years or due to certain pathologies. In medicine, it is indicated with the term benign prostatic hypertrophy, a very common pathology in men, with an incidence of 5 to 10% in those over 50 and up to 80% in those over 80. As the name itself suggests, it is a benign pathology, as the enlargement of the prostate gland is not due to the growth of a tumor mass, but to the increase in the number of epithelial and stromal cells that constitute it. Nutrition plays an important role in the health of the prostate, and in particular helps to prevent and improve the symptoms associated with benign prostatic hypertrophy and the general health of the organ. In fact, there are some foods that should be consumed in moderation, or better yet avoided, to reduce inflammation and support prostate function. But which are they? Let's go see them. Spicy foods. In the group of spicy foods, we find those foods that contain some molecules capable of activating specific sensory receptors in our body, in particular those present on the nerve endings of the tongue and oral cavity. The most common is undoubtedly capsaicin, an organic compound present in variable quantities in plants of the capsicum genus, those from which chili peppers are obtained. Although a study conducted by some Chinese researchers has shown some positive effects of capsaicin in controlling prostate growth in mice, frequent consumption of chili peppers could cause further inflammation, in particular the lining of the bladder. You may thus notice a worsening of urinary symptoms, which are already common in patients with benign prostatic hypertrophy, including an increase in the frequency of urination, which may be accompanied by a sensation of urgency or burning. Other substances with spicy properties include piperine, found in various types of pepper, gingerol, found in ginger, isothiocyanates, found in mustard, horseradish, and other cruciferous vegetables, and finally allicin, a sulfur compound that forms when garlic, onion, or shallots are cut and then exposed to air. The latter has shown beneficial effects on the prostate gland, but we will talk about it in more detail in a future video. Experts recommend moderate consumption of spicy foods in case of prostate enlargement, not so much for the direct effects they can have on the gland, but for their impact on the urinary system. Red meat and processed meat. Some studies have found that excessive consumption of red meat, especially processed meat, can have a negative impact on prostate health, especially in cases of benign prostatic hyperplasia. This effect is mainly attributed to their high saturated fat content, which promotes systemic inflammation, a process that can aggravate urinary symptoms associated with prostate enlargement. A study found that men who ate red meat at least once a day had a 38% higher risk of developing benign prostatic hypertrophy than men who ate it less than once a week. Nitrites and nitrates are also under accusation, preservatives used especially in cured meats to prevent the development of pathogenic microorganisms and improve the appearance, consistency, and shelf life of the product. The IARC, the International Agency for Research on Cancer, has classified them as probable carcinogens for humans. This is because during cooking, nitrites and nitrates can undergo a series of chemical transformations that convert them into N-nitrosamines, chemical compounds, some of which are considered genotoxic and carcinogenic. In fact, the general guidelines recommend not consuming more than 2 to 3 portions of red meat per week and avoiding, or at most limiting, the consumption of processed meats. In the processed meat group, we find those meats that have been subjected to some processes to improve the flavor or preservation, such as smoking, salting, drying, or fermentation. Some of these are cold cuts in general, such as sausages, but also canned or salted meats. In the red meat group, we find beef, pork, veal, lamb, mutton, and others. Caffeine. Caffeine is a substance belonging to the alkaloid family, a group of organic compounds found in numerous plants, including coffee, tea, cocoa, and cola. On the one hand, moderate caffeine intake provides a series of health benefits, including stimulating cardiac and nervous function, combating fatigue, alleviating pain in the case of migraines, as well as influencing the basal metabolism, and reducing the risk of some neurodegenerative diseases. On the other hand, however, men who suffer from benign prostatic hypertrophy should pay attention to the consumption of drinks containing caffeine, as they can significantly affect urinary function. This is because caffeine acts as a diuretic, that is, it stimulates the secretion of water and electrolytes from the kidneys by increasing the production and excretion of urine. Not only that, high caffeine consumption can irritate the smooth muscles of the bladder and exert a significant increase in the contraction of the detrusor, the muscle that allows the expulsion of urine thanks to its contraction. This will cause a more frequent need to urinate, worsening the urinary problems already caused by the enlarged prostate. Salt. Sodium, contained in traditional salt, is an essential mineral for the proper functioning of the human body, as it performs numerous functions, including regulating blood pressure and muscle contraction, as well as transmitting nerve impulses and maintaining the correct balance of fluids. Excessive salt consumption, however, in addition to promoting the development of hypertension, osteoporosis, cardiovascular and renal diseases, can increase the severity of symptoms related to benign prostatic hypertrophy. This is because diets rich in sodium promote oxidative stress and systemic inflammation, favoring the release of pro-inflammatory cytokines by immune cells. Not only that, excess salt can overload the urinary system and compromise the ability of the kidneys to perform their filtering function efficiently, as well as damaging the epithelial barrier of the bladder. This will increase the sensitivity of the afferent nerves to the organ, facilitating urination at low filling volumes, which will then translate into a more frequent and urgent urinary stimulus. Sodium is therefore a potential risk factor for the development and progression of benign prostatic hyperplasia, so it is necessary to moderate its consumption. In fact, the World Health Organization recommends a maximum salt consumption of 5 grams per day. Among the foods that contain a greater quantity of salt, we find cold meats such as raw ham and speck, mature cheeses such as pecorino and feta, but also bread, breadsticks, and crackers. Also pay attention to the condiments used in cooking to replace or in addition to salt, such as stock cubes, soy sauce, ketchup, mayonnaise, and mustard, but also to all those salty snacks such as peanuts, chips, and popcorn, as well as some sauces and ready-made dishes. In conclusion, we have seen that to keep the prostate healthy, it is important to pay attention to our diet, as what we eat can reduce the risk of developing benign prostatic hyperplasia or worsening its symptoms.